Today's answer is all about eye ulcer causes and the treatment of eye ulcers in dogs and cats. Okay, and my final question comes from Julie, who has got a 16-year-old Jack Russell that's got an ulcer on his eye, and she'd like to know how she can treat him. But there's also another problem. So the ulcer on the eye is just an addition to a growing list of problems, and that includes idiopathic vestibular disease. It involves an infection in the nose, sneezing, losing weight. He's actually lost he's lost kind of 400 grams, which is nearly 10% of his body weight recently. He started on a number of different treatments. He's really challenging to medicate though. The vet recently gave Newbie a long-acting antibiotic injection as an alternative to tablets, and then his health seemed to rapidly deteriorate. So she's wondering if there's any link to the antibiotics there, and really just looking for general advice, not just about the eye ulcer, but treating Newbie in general, kind of with all the challenges that he's got. Now, I'll start off by saying that this is a really challenging one to answer in a forum such as this, because it's like there's many different health issues all contributing to the overall health picture that we've got in this kind of geriatric dog. So if we start off with eye ulcers, now there's a number of different causes for that. By and large, we treat them with an antibiotic ointment that will help prevent infection while the ulcer heals. But equally, it depends what the cause of that ulcer was. If it's caused by something called dry eye, then we need, as well as tear replacers, we might need a specific treatment, a specific eye drop for that is actually an immunosuppressant that tries to encourage the production of tears. If it was due to a foreign body, so something being stuck under the eyelid, then clearly that needs to be removed. If it was caused by something called an entropion, which is the rolling in of the eyelids, which then the hair on the eyelids kind of scratches the eye, then there's specific treatment that we need for that, which is typically surgery to correct that rolling in of the eyelids. That's not necessarily going to be something that we're going to be wanting to doing in a dog with an awful lot of other problems. So that's kind of the eye ulcer, if you like. So often we'll just give eye drops. We'll give painkillers at the same time, because eye ulcers are sore. If you've ever even had a tiny bit of dust in your eye, you'll appreciate it feels like a giant rock. So we want to be treating for pain as well. Now, moving on to the kind of the long-acting antibiotic injection that was given, and then the deterioration in health. Now, antibiotics, they do have potential side effects, just like everything that we give. The most common side effects are gastrointestinal, so that's kind of diarrhea and vomiting. Now, allergic reactions are very rare. They tend to happen minutes to hours after administration, if they're going to happen. But like I say, they're very, very rare. And so, I mean, my suspicion would be that the signs that she saw in Newbie after that injection was given are more likely a reflection of the underlying disease. So it sounds like there's something serious going on that's resulted in that weight loss. We've got a really unwell dog, and it's more likely that actually that's the cause of the deterioration than anything. And I'd always say that if a pet is not responding to treatment as expected, always reach out to your vet, even if it's only a matter of hours since they were last seen. So if they're getting significantly worse, then we need to know about it, because it might be that there's other things that we need to do. It might be other treatments that we need to give, other tests that we need to run. It might be that hospitalization is the best thing. And the bottom line is that, we seldom deal with absolute certainty when it comes to our pet's health. Not all patients respond as expected. We're dealing with biological systems, not kind of mechanical structures, so we can't guarantee a response to treatment. Even if we know exactly what's going on and we're giving exactly the right treatment, not every individual dog or cat will respond the way they're supposed to, if you like. So there are variations with individuals there, and it's important that you keep in touch with your vet. If things aren't going to plan, let them know so that they can jump in with any other intervention and any other plan that needs to be made. Now, as far as general advice for a senior dog who is slowly deteriorating, my advice here is that quality of life is key. So we want to be thinking about comfort, making sure that we've got some pain management strategies in place. We want to be monitoring appetite and thirst, so keeping them eating, keeping them hydrated is very important. We also need to try and stay on top of known medical issues. So in this older dog's case, we know there's a number of things. We want to be trying to manage those as best we can. And we also need to keep in close contact with your vet, especially as things change, as I've just discussed. And then finally, when we're thinking about kind of helping improve the quality of life of our senior pets, we want to just manage their environment to make life as easy as possible, as easy as we can. And that can involve things like using a ramp to get up into the car, trying to avoid steps, making sure the bedding is nice and soft and draft free, putting rugs down or runners down on the floor, just on a slippy floor, just so that they're not falling over and exacerbating their arthritis, for example. So we just want to be making life as easy as possible. And then we need to monitor, and we need to keep an eye on that. We need to always be asking the question, what is my dog's quality of life? And we want to be ready to step in if they're suffering or if their quality of life is significantly deteriorating, despite doing everything as everything that we can and as much as possible to try and prevent that. Because ultimately, there's going to become a time when they're not happy, when they're not doing well. That is the usual picture rather than a one-off. And, we need to start thinking about euthanasia. So making that euthanasia decision, it's very hard, but delaying it and actually leaving your pet to suffer for too long is one of the biggest regrets that I hear from pet owners in my consult room. They're often saying, my last dog, my last cat, we left too long, and I look back and I regret leaving them in pain or leave them suffering for too long. We have the option to remove their suffering for them. It's a great privilege that we have in veterinary medicine. We don't want to jump in too early. We don't want to go, oh, they're just old, let's just put them to sleep at an early stage when there's still treatments that can be given and they're still happy. But when things start to slide, despite giving them the best treatment and the best care possible, we want to be stepping in. And I've actually got several articles over on ourpetshealth.com where I discuss senior dog care, I discuss palliative care when we know that they're kind of on that downward slope and they're reaching the end of their days. And I've got an article discussing when the right time for euthanasia is. So if you've got an old dog, then these are definitely things that you should be thinking about sooner rather than later, because that's going to actually mean that your dog has a better quality of life for longer and is likely to live for longer as well, if we're thinking about these things at an early stage rather than waiting until they're in a really bad way before thinking about them. So I definitely encourage you to check those out if you've got an older dog, even if they are healthy.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.